Hello, DeLand. Thank you to everyone tuning in today. I'm Public Information Officer Chris Graham, and this is a part of a series of videos that we've been working on to keep our community informed as we face the COVID-19 pandemic. Today, I'm honored to be joined by President and CEO of AdventHealth DeLand, Lorenzo Brown, and Chief Medical Officer, Dr. Joe Smith. Thank you, gentlemen, for joining me today.
Thanks for having us, Chris.
Yes, Chris, thanks for having us. We're happy to be here.
Yeah, and obviously, as our community faces this public health crisis, there have been a lot of questions surrounding healthcare, of course, testing and the virus itself. Volusia County has now recorded more than 200 cases of COVID-19, and DeLand has 21. And I think we can anticipate that those numbers may rise in the next few weeks. So my first question is to Lorenzo. What is the current capacity for AdventHealth DeLand, and how is the hospital system prepared should we see a surge of patients in our area?
Okay, good question, Chris. We've been working to prepare for the surge as far back as February. We've made significant investments in technology and infrastructure and personnel just to make sure that we're prepared for what may come. You know, we've been a 20-year partner in this community, and we believe that our efforts to make sure that the community is safe are well underway. In addition to what we have right here at DeLand, being part of a large organization allows us to also meet the need of patients, meet the needs of patients if we have to transfer them to other facilities. A couple of things we've done specifically for our surge is we've early on in our process began to create task force that allow us to go deep in some very specific areas around nursing, making sure we had a deep bench around medical staff, as well as making sure that our HR and our personnel was really a solid plan for those groups as well. We've also worked to bring a number of, reduce the number of patients that are actually in our hospital by eliminating elective surgeries. That way we're able to really provide the maximum amount of bed capacity to patients if they need care for COVID, as well as developing robust surge plans that allow us to expand beyond kind of the walls of our facility. We've worked with an outside international consulting company to help us model what we expect the surge to be. That way we can base our equipment needs, our bed needs, our staffing needs off of data. It's updated real time and allow us to stay on top of the cases that are coming into the community. In addition to that, I think we've worked with your office as well as the county and the state to make sure, should there be a need for a kind of a field hospital, we're well down the road as far as being able to plan and put that into action. Our plans, I think, allow us to, while we hope for the best, I think our plans and contingencies allow us to be prepared for a worst case scenario should it come to our community.
And I think it's good that, we haven't been a hard-hit area so far, and hopefully that continues to be the case. I know one of the biggest questions has been about testing. A lot of people didn't know, should I be tested? I think I have symptoms. I think there was a lot of confusion about that. I know AdventHealth, you guys started testing at Daytona International Speedway. How is AdventHealth handling testing on site here in DeLand? And do you guys think that there will be an increased capacity for testing specifically in West Volusia here in the near future?
Yes, Chris, absolutely. So the Daytona International Speedway option was really put out there so that anyone in the community who felt that they should be tested had access to a test at no cost to the patient. We're very proud of that, and that's stood up now, and you can get additional information on AdventHealthCoronavirusTesting.com. or you can call 1-877-VIRUS-HQ. Here at AdventHealth DeLand, we've had enormous improvement in the testing. I know that, and I think it's important to acknowledge the frustration that was out there early on in the pandemic, and it's important to underscore that this virus was essentially unknown to American healthcare until late January of this year. And so this testing had to be developed from scratch, obviously borrowing on techniques that we've had before, but we had to develop tests for this. There's really an unsung army of heroes out there at the universities and laboratories in America that have made that possible. That's been unbelievably successful, really overshot even my wildest dreams. And so now we have the capacity to test thousands and thousands of patients a day. Because we are this large network of hospitals that is AdventHealth, we're able to shift that volume around our network so that you can get test results now within just a few hours. Anyone who's feeling sick should certainly contact their primary care physician. If you don't have a primary care physician or you're not able to get in to see your primary care physician, all of our center cares are able to do the testing now, which is a great resource to everyone. And it's important to know that unless you're very, very sick, short of breath, experiencing chest pain, you don't have to come to the emergency department. We have these other options for you out there in the community so you can get testing in a way that's convenient and safe.
It's very good information to know. I've seen the center care locations, and I've seen the tent setup, so that's good to go to if you need that help. I guess, Dr. Smith, what are you seeing with patients locally? I know the state really isn't monitoring people that are recovering. They aren't releasing those numbers. What are you seeing with patients locally, and how severe are the cases in our area?
Sure. Great question, Chris. So, this virus is interesting in that we know from some of the studies coming out of other countries and in this country as well, the majority of patients who get this actually experience no symptoms or very mild symptoms, right? The patients who come to the hospital are likewise over a very wide curve of symptoms ranging from, wow, I really feel pretty crummy, to needing to go to the intensive care unit. And that's how the virus has played out here in DeLand. The majority of the cases that we have identified in our hospital have been identified in and then released from the emergency department to recover at home, and those have been successful. Those are folks that have done very well doing that, just like you and I might do if we had the flu or any other serious viral illness. We have had a number of patients who were critically ill, and I'm very pleased to report they've all had very good courses, very good outcomes. We've been able to administer hydroxychloroquine in combination with azithromycin, which is an investigational combination of drugs that's been shown in some of the smaller studies to have effects. We've had good results here. AdventHealth is also one of the nation leaders now with administering convalescent serum, which is where we take blood from someone who has survived this virus and cleared it, and we can process that blood and get the plasma from that person that contains antibodies to somebody that is experiencing this virus for the first time and help give their immune system a jump start. So we're doing that with our community partner down in Orlando. So really exciting stuff. But the vast majority of people that have this, it's going to look a lot like hay fever or a mild cold, and then it ranges all the way up to flu-like symptoms, even to being very, very short of breath and needing help to breathe.
Yeah, I know a lot of people, it's kind of a silent virus. A lot of people are just kind of wondering, what is it going to be like if I get it? What are some ways that people can prevent themselves from getting the virus? I know social distancing and staying at home are the biggest things. What are some additional options for people?
Yeah, so all good questions, and I appreciate that the community really has that sense of curiosity. They want to learn more. The biggest thing is knowing where these have been, know where your hands have been, right? You should assume, okay, and not to instill fear, but a safe way to approach things is to assume that any surface you touch could be contaminated with this virus. And the vast majority of people who get this virus is through what's called droplet transmission. So you touch something with your hand that someone has maybe coughed in their hand and they've touched something, then you go to touch it and you rub your eye, you rub your nose, you touch your mouth, and that is how most people are going to get this virus. So if you are really good about discipline with your hand hygiene, meaning wash your hands often with warm soap and water. It does not have to be antibacterial soap or any kind of special soap, but just any soap and water to cleanse that off, 20 seconds, 30 seconds, do a really good job. And then be really careful about where you put your hands and touching your face. Use hand sanitizer often. Don't shake hands. And then there's a lot of talk now about the masks. What is the role of the mask in the transmission of coronavirus? Like I talked about, this is mostly what we call droplet transmission, right? So you cough, you speak, And when, no one likes to think about it, but when we speak, small particles of fluid are going to be aerosolized out of your breath, and they could land anywhere within 2 to 6 feet of you, okay? The mask really helps to prevent you from spreading virus if you are one of these patients who's either experiencing symptoms or not experiencing symptoms, and helps to prevent other people from getting it. What the mask doesn't really do very well is filter out viral particles, right? But that's less important. What it does for you is keeps you from actually touching your face by forming that physical barrier. You won't touch your mouth or your nose. So that's where the masks come in. The other biggest thing is certainly making sure that you're adhering to all of the stay-at-home orders and just exercising good judgment about avoiding crowds and staying away from people that might be sick. A lot of us like to come to work sick, it's sort of a badge of honor in our society. Nobody's worse about that than medical professionals. That needs to stop. If you're not feeling well, stay home. If you are feeling well, stay home unless you need to go out.
Yeah, and I know that's a big thing for government. We like to come in to work sick, but that's something that DeLand has taken seriously. And anyone who's feeling sick, we've told them you need to go home and not spread any illnesses.
That's right.
And you guys are on the front lines. You're nurses or doctors. Thankfully, we haven't been hit very hard. But how are you guys doing? I mean, what are some things that you're doing to cope with potentially contracting this virus?
So, healthcare workers are human beings just like anybody else. And so, our nurses and doctors have families at home that they're worried about. They're worried about contracting this themselves. But I got to say, the overwhelming majority have been just amazing. The grit that I've seen and the spirit that I've seen emerge from our teams is it's really something to see. I'm thinking back to these images of war bonds and Rosie the Riveter. The number of people that are just rolling up their sleeves and saying, "We got this. We're going to come in and do this." That's been amazing. Our company has really done a couple of things that I think are helping people focus on the work ahead. And I'm very very proud of our organization for making sure that nobody's losing their job over this. That hasn't been something that every company's been able to do, and even every healthcare organization hasn't been able to do, which is really so sad to think about. We've tried to do things like expand benefits so that our staff know that they can get testing at no charge to them. We've been able to defray the cost or pay for hotels for anybody that is in a scenario where they might have been exposed and don't want to take this home to their family. And we focused a lot on what will the recovery look like. We know that if we look at the cases in the state of Florida, our highest day so far was April the 3rd in terms of new cases per day. And things have really sort of flattened out or even improved a little bit since then. So we're focusing a lot on what will the aftermath of this be like? How do we bring people back into the healthcare community that have been home, waiting, delaying care that could be delayed, and I think that was the right thing to do. But how do we support our teams through that? Because they're going to get a whole lot busier after this even. So, just loving our team, staying really close to them, a lot of visibility. Lorenzo and I can attest to a lot of late night visits with teams and, making ourselves very, very available. And the staff have been, again, nothing short of amazing.
Yeah, and, the community also. I've seen a lot of community support. You see the videos of people coming outside the hospital and honking the horns. I know our fire department came out last week and we played bagpipes. And actually tomorrow, on Wednesday, our a bunch of cities in Central Florida are going to be ringing bells of thanks for healthcare workers and first responders. Lorenzo, is there anything else that the community can do to help the hospital system? Is there any requests that you guys have?
That's a great question. The outpouring of support has just been absolutely amazing and so appreciative. There are a number of team members who just feel like hometown heroes because of the way they've been received and supported through the community. One of the important things to remember is Dr. Smith mentioned that the stay-home order is still in place, so we're still encouraging people to stay home as much as possible. That's really the best way to prevent the spread. You know, when you think about ways to support our team, food packages is always welcome. You know, I've never been to a unit where they didn't welcome donuts or some kind of refreshment to boost their spirits. You know, interestingly enough, there are a number of team members who actually are affected by the virus, so care packages that go home with them are also a nice way of saying how much they're appreciated. Lodging in some cases is also a great way of saying thank you. Some members that are going to be on call or may have to come in from out of the area, having lodging as an available option. If folks are interested in providing financial support, AdventHealth does have the ability to log on to our website, www.adventhealth.com/COVID-19 relief is a way that many are able to participate financially if they want to provide some support that way also.
Okay, well, that's very good information. Anything that we can do as a city to help you guys, we're more than willing to do that. Just one last question. This is for both of you. There are a lot of people who, I guess, are scared and don't know really what the next few weeks or months will bring, both financially and health-wise. What is your message to them? And I guess, what do you see as a new normal? And do you have any insight as to when that might occur?
I'll start, just by saying we're ready. We've done a lot to prepare for this. As I mentioned earlier, I've been working on this for weeks here and believe that we have the infrastructure in place, the staff in place, and supplies we're going to need to really care for the community should they get sick. We have, in addition to that, robust emergency management protocols that we've been working on, and I believe that the community should know that AdventHealth DeLand is ready to care for them should they need it.
Yeah, and I think on top of that, it will be, so that's the important message, is that we are ready. It will be a slow entry, though, back to normal. I liken this a little bit like a spring, right? And so all of the social distancing and the stay-at-home orders, that sort of press the spring down. And the thing that we don't want to do as a country is take our foot off that spring too quickly, because then this infection rate will spring right back up. So in the coming days to weeks, I think what you will see is a slow entry or rolling opening of services that get us closer and closer to something that looks like normal. This virus, though, having said that, will be out there, long term. It doesn't go away. And so there are diseases that have been around for thousands of years that we live with that cause plagues. The Black Plague is a very famous plague that affected Europe in the Dark Ages, and most people don't know there's actually a reservoir of plague, Yersinia pestis, in prairie dogs in the Midwest in the United States. But we have containment measures in place, and that's not something that plagues us on a daily basis, if you will. So this will be something that is out there. I think what we will see is a vaccine will emerge in the next 12 to 18 months. A lot of us will get this infection and will have no symptoms, but we will carry antibodies to it. And once this thing has sort of burned down, we won't be in a situation where we have cities like New York that are getting overrun. And so I think it will take some time, but it'll be a slow, steady march back to normal, probably with a few good habits learned in the meantime. And those habits are things like washing your hands, staying home when you're sick, some responsible things like not flying when you're sick, right? Not going into crowded places when you're sick. And so, new normal, I think, will look a lot like the old normal, but maybe with some better habits.
Well, that's some hope that people can have for the future. I know a lot of people are ready to get back to their normal lives. I know I am. I'm sure you guys are too. Again, thank you for taking time out of your busy schedules. I hope you guys stay safe, DeLand stay safe, and hopefully in a couple weeks we can come back together and talk about what we learned and what we went through. So again, thank you guys. Thank you guys. I appreciate it.
Thank you,
Chris. Take care.
Stay safe.